Thank you. So, Saul, I just have to start. You were absolutely right this morning. I went home last night, had a great dinner with 4 people who are wonderful friends here at this conference, including one of my doctoral students who I'm happy is here. Went home, my wife was asleep, kids are asleep. I wake her up. I say, Amy, this conference is great. They're fantastic talks, and the public speaking quality is the best I've ever seen. She didn't wake up. She sort of rolls her eyes at me, sighs, and says, Peter, you spend most of your time going to scientific conferences. The bar is not that high. So what I'd like to do in the few minutes I have is tell you about a paradigm shift in science that's going on right now. And it's really exciting. And this is moving, as we just heard the challenge from the president from Babson College, moving from doing to knowing in a very exciting way. The whole paradigm shift in science is one that we're living through at the moment. And it's involving large institutions that are some of the most conservative institutions in the world: healthcare, traditional academia, and the pharmaceutical industry. Tough to change these behemoths, tough to move their direction. But when I joined Pfizer, I spent 8 years as a clinician and director at Pfizer in the late 90s and early 2000s. And when I joined as a clinician and I was given the role of taking over research and development for novel biomarkers for CNS disease. And this was an effort that goes across all of Pfizer's campuses involving 100 different scientists and engineers. And the goal is to develop novel diagnostics that accelerate the discovery of new therapeutics, shorten clinical trials, expose fewer patients to novel chemical entities that we don't know enough about yet in order to rapidly develop new interventions. And one of the main areas that Pfizer is involved with and has been is in Alzheimer's disease. And Alzheimer's disease is a real serious public health issue that's getting larger by the year. By the year 2050, we estimate that in the world we're going to have double the number of patients afflicted with this devastating illness, over 50 million people. The potential, if we don't come up with a agent that's able to slow the progression of the disease, forget about a cure, slow the progression of the disease, we will cripple our economic healthcare system. The socioeconomic costs to society, to employers, to caregivers will be devastating. So we've got about 20 years to get to the point where we have a therapeutic that actually slows progression. And one thing we need are ways of tracking subtle change in disease over time as we administer experimental drugs. And imaging, neuroimaging, is, of course, a very important tool. But when Pfizer was looking at different neuroimaging techniques and different metrics, actual metrics to use to look at change over time, we didn't know which to pick because the literature is scattered. And that's because the traditional paradigm in science is that you have individual investigators like myself with my graduate students, with my R01 grants, working in my own lab, and perhaps collaborating with several other labs, but we're all functional islands. But the information we're working with in today's age is just massive. And so what we faced in the late 90s were all these little labs doing imaging studies, coming up with different results. And we brought them all together for a conference in Washington in 1998 because I thought that this was the way to solve the problem, was to build a consensus. And we had this phenomenal conference. It was very exciting, but we had no consensus because you had different camps doing different things, and everyone's going to champion their own metric, their own measure above others. So what I realized we needed at the time was we needed a bake-off. We needed to create a way to have a common library that we could then ask all different labs that are developing different metrics to use that common library and the common method for getting the data in order to compare in a horse race that would be fair. So in the late 90s, we approached the NIH about a study that has become the Alzheimer's Disease Neuroimaging Initiative. And if you go to adni.org, adni.org, you'll find it. And what we did with the NIH and with a number of private philanthropies was something that is now being expanded dramatically, but it was incredible at the time, and it still is. It's still going on today. Pfizer took the lead in bringing together 11 companies. It's now grown to over 18 companies, contributing $23 million as a group on a pre-competitive basis to develop biomarkers for Alzheimer's disease. This is something pharmaceutical companies have never done before. And it took years of negotiation to get the companies to understand that, look, our real competition is in developing drugs. We all need the biomarkers to prove to the FDA that the drugs work. And if we don't have our biomarkers peer-reviewed, then why would the FDA believe us? So if we all develop our biomarkers in-house and keep them close to our vest, that's just not going to work. So on a pre-competitive basis, we formed this group, which still is going full steam. The NIH kicked in $40 million. This is huge science, over $60 million over 5 years. We've enrolled over 800 patients, 400 with mild cognitive impairment, 200 with Alzheimer's, 200 healthy controls. We've been following them every single year with multiple serial imaging and other lab-based biomarker tests. We have all the genetic information, and imagine this. One of the companies took all the genetic information from blood, amplified the DNA, and shared all of that whole library of information with all the other companies. Amazing. The NIH, in putting this together with us as a consortium, said, we have one stipulation. If we're going to do this, then this can't just be to the benefit of the companies. $40 million of taxpayer money is going into this. This has to be to the benefit of the greater common good. So we created a untested, doing before knowing mechanism of rapidly sharing information across the world for free. If you go to ADNI and you're an Alzheimer's researcher from anywhere in the world, you can register at the site, and you can have access to the entire database, the imaging, the clinical data, the CSF lab values, all of it for free. And we have now approximately 2 investigators per day, every day of the year for the past 2 years, registering at that site. We have about 30 papers so far published from the database. We're in our 5th year, from 15 different countries. And what we realized in the process was that this project was so massive and the bioinformatics problem was so large that in order to actually eke out everything that we could from it, the only way we could do it is by sharing, is by getting enough people from around the world to access that database and publish on it that we could rapidly achieve our aims. So this is this unbelievable situation where you have, now it's nearly 20 pharmaceutical companies, imaging companies, diagnostics companies, universities, private philanthropies, and the NIH supporting this project that's now going to go into its 2nd, 5th year period. And we're going to learn more about the subtle change over time in this disease than we've ever learned in the past 100 years. And we're going to be able to have the measures we need as we're rapidly getting to the point where I honestly believe we're going to have a therapeutic that slows progression within this next decade. So, thank you.
That's really about not just a research flip, but a mindset flip, I think. Talk, if you can, it's hard to do it in a minute, but talk about within Lifespan now, because you're now with Lifespan.
Yeah.
How do the sort of scientific professional mindset flips need to operate so it's that within the organization, people begin conducting themselves with the same notions that you've built with this consortium across organizations?
Well, I joined Lifespan, the hospital system here in Rhode Island, the largest one, about a year ago at a rather interesting time with the economic downturn this past October. And it's nothing like a bad economy to get people to think a little bit out of the box. Lifespan, like most other hospital systems, has always organized itself vertically. If we need it, we build it and we own it. But we realize that in a small state, such as Providence, when we have our university that we're affiliated with 2 miles away, and we have University of Rhode Island, which is a stellar university with all sorts of great resources 20 miles away, and we can't do this in a vacuum any longer. So we're looking at a true paradigm shift to share, to cost share the risk, and share the upside on many, many new initiatives that we're building. And this is a real foundational change at the most senior levels of all three organizations. And it's a definite push-pull, but we're inching our way forward. So we have all sorts of new shared initiatives with Brown, with URI, with Care New England hospitals, with other hospitals inside and outside the state, in order to make sure that we're developing a capability that's going to be able to handle the big science that I've been describing for years to come. Because we're rapidly moving past the age where we can just help nurture isolated little groups.
Great. Good luck. Peter Snyder, Lifespan Health. Thank you.